This is a recording on psychiatry and glorifying the use of coercion as cure and how that is the shame of medicine. These are excerpts from Thomas Szasz. Um, he begins by saying that psychiatry is a trap, not treatment. The identification of psychiatry with medical healing and humane helpfulness is factually false and morally deceptive, concealing an existential trap with untold potentials for injury and death for the entrapped. More successfully than ever, the modern biological psychiatrist misrepresents his profession as based on biological science and medical discovery, while more than ever it is based on pseudoscience and therapeutic deception. The psychiatrist stigmatized persons as mad, deprived them of liberty, and assaulted them with chemical and physical interventions. A little more than 100 years ago, individuals began to seek psychiatric help for their own problems. As a result, many people who entrusted themselves to the care of psychiatrists became entrapped in the machinery of punitive mad doctoring. This is dramatically portrayed in Ken Kesey's best-selling novel One Flew Over the Cuckoo's Nest and the film based on it. The recent film Changeling, not so recent now, but the film Changeling presents a real-life example, and so does Alan Turing's Psychiatric Undoing. Psychiatric destruction often begins with psychiatric self-destruction, the denominated patient believing the psychiatrist's self-deceptions about non-existing diseases and their damaging treatments. The worst enemy of truth and freedom in our society, declared Henrik Ibsen, is the compact majority. Yes, the damned compact liberal majority. Let us not forget that the power of science is limited to informing and misinforming. It does not have the power to coerce. In contrast, power to coerce is the very essence of psychiatric pseudoscience allied with the state. Psychiatrists regularly characterize their power to coerce as suicide prevention. The opposite is often the case. Countless of Alan Turing's gay contemporaries at Cambridge and in London, Wittgenstein, Keynes, Leighton Strachey, many of the apostles in Bloomsbury's sensibly stayed away from psychiatrists. Many famous people, Gandhi, Russell, and Nehru, spent time in prison, though, and went on to do memorable work. This is not true for people imprisoned in mental hospitals. After the psychiatric degraders finish their job, the patient is dead, if not biologically, then socially. Turing did not consider his homosexuality a disease, a crime, or a shameful condition. He suggests that Turing opted for medical treatment rather than a brief period of imprisonment because he feared that a criminal conviction would be fatal for his career. Even in death, psychiatry and the state stigmatized Turing as mad. The posthumous diagnosis of suicide as mental illness is the ritual degradation ceremony of our therapeutic age. Much as the posthumous burning of the heretic's corpse was the ritual degradation ceremony of an earlier theological age. Turing was the victim of medical doctors who declared male homosexuals ill and declared torturing them as a form of humane medical treatment. As long as psychiatrists are accepted as medical specialists possessing the privilege to forcibly classify persons as patients and impose tortures on them as treatments, they will not apologize. German politicians have apologized for the Holocaust. American politicians have apologized for slavery in post Pearl Harbor concentration camps. Psychiatrists have not apologized for their institutional misdeeds. Physicians who work for the government's law enforcement apparatus do not practice therapeutic medicine and are not healers. They practice anti therapeutic prosecution. They are professional injurers who define the harm they do as help. Such doctors are medical criminals, the gravity of their crimes depending on the particular laws they help to enforce and the methods they use. Alan Turing was treated inhumanely because he, as well as his doctors, failed to heed George Washington's famous warning. Government is not reason, it is not eloquence, it is force. Like fire, it is a dangerous servant and a fearful master. Alan Turing was allowed to choose between imprisonment and medical treatment. He made the wrong choice. Despite his high intelligence and familiarity with medical crimes in the Third Reich, Turing failed to understand that medical criminals abound in all modern societies, most insidiously in so-called free societies. He could have gone to prison, where he could have worked, had visitors, and would have been unmolested by psychiatrists. That's Thomas Szasz. And a little bit more about Alan Turing. In World War II, Alan Turing broke the Nazis' Enigma code and saved countless lives, but he was arrested and chemically castrated for being gay. He committed suicide on June 7th, 1954.